Hey, it's Scotty. I recently got 2 different emails asking about Bumblefoot, and I referred them to my Bumblefoot videos, and I made a Bumblefoot playlist because I realized I didn't have all of my Bumblefoot videos organized in a playlist. When I rescued Ron and he had his worst case of Bumblefoot, I made a video about that. And then 10 days later or so, I made another video about his progress. And then I think I made even a third video. And then I made a video 9 months later. During the course of that was the worst Bumblefoot that I've ever experienced, ever encountered, ever had to deal with healing. And so I learned a lot during that process. Now, Ron, sadly, because of his situation, he was living in a rabbit hutch outdoors, probably in wet bedding and in very cold temperatures in a rabbit hutch that had a heating lamp. Now, what happens is a heat lamp is going to provide heat, probably too much heat in one spot, and then it doesn't have a wide enough spread. So these piggies were probably huddled in one spot, soiling it, sitting in wet bedding for a long time. And that, of course, when you're not moving and you're in wet bedding and the feet are wet, that can cause the Bumblefoot. So regardless of that, I learned a lot during those bouts and the reoccurrence of it. And so I wanted to summarize for people. I definitely still recommend that you watch those videos because I go into a lot of detail about the materials, the medicines, but I wanted to do a quick summary to explain what I think works well and what you need to do and what you need to expect and what you need to ask your vets for in order to really have a good chance of curing Bumblefoot, but also with the understanding that sometimes Bumblefoot is a chronic condition and it can come back, but it should be something that you can manage very well, very easily. First off, Bumblefoot, if you Google it, if you Google guinea pig Bumblefoot, and you look at my other videos, you'll see that it's a raw wound in the paw. Usually it's the front. A lot of times the back feet get sore, but it's really bad when it's the soft pads of the front paw. So how do you cure it? It is not only medicine, but there's things that you need to do in conjunction with the medicine. But let's talk about the medicine first. First, antibiotics. Now, you could probably use a bunch of different antibiotics. We used Baytril, that's enrofloxacin, but you could probably use Bactrim, that's trimethosulfate, something, These medicines go by their brand names as well as their actual medical medicine names. But whichever one your vet thinks will work. Some are harsher on the stomach and the digestive system. A side note is that I've always heard that whenever you're using an antibiotic, especially ones that can be harsh on the digestion, that you use a probiotic like Benebac probiotic paste, or you can also use the any emergency food that has a yeast culture ingredient. Those all have probiotics. And the rule of thumb generally is that you want to give it at least an hour before or after the antibiotics so that they don't counteract. That's just what I've always heard. And since that's what I've done, I don't really have any anecdotal evidence one way or the other, but that's what we always do. And I definitely have seen positive results using the probiotics. Usually it prevents the formation of soft poops, or if they do come, it helps get that back on track. So antibiotics, number one, is the most important thing to really help heal that wound, especially when it's really, really bad. And with Ron's, it was some of the worst that I've ever seen. So in conjunction with antibiotics, an anti-inflammatory / pain medicine, Metacam or Meloxicam, is really important. Both of these working together is what's going to heal that Bumblefoot, heal the paw, and reduce the inflammation. I've tried to use antibiotics without the Meloxicam, without the Metacam, and didn't have good results. And once I added that back into the regimen with both of those, I really saw the swelling come down and saw it heal. So you really want the anti-inflammatory Medicam, meloxicam in conjunction with the antibiotics when you're starting off that. Okay, now during this whole course, you've got to do foot soaks, okay? And you've got to apply medication and you've got to wrap the foot. But there are ways to do it that will help it heal, and there are ways that can actually hurt. And before I get into that, I don't want to forget that in Ron's case, and in some of these cases where the wound is so bad, piggies have a tendency to chew on that wound. And Ron actually bit the tip of his finger off. It was very frightening, but animals have a tendency to do that. When they see a wound, they will chew on it, and please do not let that happen. So when you are changing the bandages, if it's really bad, when it's irritating them, be aware that that is a possibility. Don't give them the opportunity to chew on their paw and hurt themselves, because when it's really swollen, shocking, I just want to prevent that. Okay, so back to the wraps and the soaks. You want to soak in either plain Epsom salt or betadine or an iodine solution that's diluted in water. If you get the Epsom salt, you can either do this in like a salsa cup or a guacamole cup, one of these little plastic cups that you get, maybe a ketchup cup, something like that, and you can just put the paw in. That way you're not actually sitting them in a wet pan and getting them completely wet. But that's fine if it's really bad and that's the only thing that you have, you think that's the best way. But if you can have someone hold them, or you can hold them and put their foot or their paw in that, and you just need to soak for 5 minutes in some kind of soap. The iodine, the betadine solution, that's going to be antiseptic, and it also helps with the swelling. And the same thing with the Epsom salt. It helps with the swelling, and it's antiseptic, and it cleans that wound. But then you do want to put some kind of antiseptic. I like a betadine spray. Bactine, sorry. I meant to say Bactine. You want to do the Bactine spray to really disinfect that wound. And sometimes when you're soaking, it will cause it to bleed. If there was a scab and the scab comes off, that is totally normal. If you have to apply pressure for a minute or two, don't put styptic powder in there or anything. You want to keep that really clean. But if you can apply pressure, get that bleeding to stop. But that's going to be something that you're going to constantly be fighting. So very important that you disinfect. Make sure the wound is dry. And then there are 3 choices that you have for what to put on that wound when you wrap it. Okay, the first thing is you should use, and you should get this as a prescription, SSD, silver sulfate, SSD cream, silver sulfa something cream. And you have to get it by a prescription, but that promotes new tissue growth and healing, and is very good. Manuka honey is also an alternative, so actually 4, because the CBD that the LA Guinea Pig Rescue has, we've used that too. And you can use these in conjunction with each other. I wouldn't mix the Manuka honey with these other things because it can be a sticky mess. But the 4th thing is antibiotic ointment, regular triple antibiotic ointment or single bacitracin. All of these work. At first, I would stick with the silver SSD cream, put that in, and then wrap it. You wrap it in gauze, and then you wrap it in a vet wrap. You might have to use tape, and I would just wrap it for a couple hours, 1, 2, 3 hours, and then take that bandage off. And if it's really bad and really gross, put them on a towel, someplace where you can monitor them, and let that wound air out. Okay, you don't want to keep the bandage on 24/7 because that can, have you ever had a Band-Aid on your finger? You had to start it out with a cut, you left the Band-Aid on for a day or two, and then you pull it off and your skin is like white, pale, and wrinkly and like rotten. You don't want to do that, okay? So that is what you want to do, and you want to let it air out so that hopefully a scab can form. Now after a week or so, sometimes the scab will start to come off. And as you know, when you have a scab that's hanging on and then it comes off, sometimes that will cause bleeding. You're going to just need to repeat this process a couple times. Okay. I really hope that this sort of gets you thinking about the overall process, what you need. So when it comes to the bandage, you can try the Manuka honey on days that you don't do the silver cream. You can mix the silver cream and a little bit of antibiotic ointment. That works really well. And you can also put a little of the CBD cream on and let that absorb in before you put on either of those. So those are some of my tips and tricks for the how to cure Bumblefoot. I will put right here the entire Bumblefoot playlist. This is for you guys that are dealing with this, or if you never saw the original Bumblefoot video, I encourage you to watch it. It was mind-blowing how people can let their guinea pigs get to this state. So thank you guys so much. All the patrons and the subscribers and the channel members, you are the ones that allow me to share the information that I've learned volunteering at the LA Guinea Pig Rescue. All right, until next time, thanks for watching.